afraid to just put that out there, and that's why we end up with a whole gospel frequency for 24 hours.
But not just a frequency, but an industry.
A whole industry.
A whole industry.
I mean, when you think about the chow and choker, the sorrel and pastel, the camp caravan, these are all ideas that Jamie pushed, and thousands of people across the country participated in, you know.
I remember the first time I realized how big the gospel movement was. I saw a video of, it was somewhere up in the east side. They have this big gospel show, and it was literally thousands and thousands of people. And I was like, what show is this?
You couldn't believe,
I
right?
couldn't believe it.
Yeah.
And let's not forget that it is also ministry.
Yeah.
So not only the industry and the commercial side of it, but it's ministry as well.
Yeah, but
Good afternoon, I'm Mahalia Joseph Wharton, and this is TTT Live. We go now to the Diplomatic Center in St. Anne's for a press briefing by Prime Minister Dr. Keith Rowley. We're bringing you live coverage on TTT Live online on Facebook, Talk City 91.1 FM and Suite 100.1 FM.
Good afternoon once again, members of the media, ladies and gentlemen of the national community, those of you who are on your various platforms, both at home and abroad. I wish I could say sprightly welcome. It's not really a welcome. As we are called again to continue our assignment, and that assignment is monitoring our progress or lack thereof and responding to the circumstances as they exist. It seems like only 2 days ago I was here, and sometime before that, not too long before. What we are doing is trying to stave off a calamity. In Trinidad and Tobago, I can't help but repeat this. Our approach is and continues to be that we acknowledge the presence of the threat, the virus. We follow the advice of the scientific group in our health department, and we monitor how the population is responding or is being threatened. Today, I want to express my personal and official disappointment in the response of the national community. Even after we have been on this since mid-March, I would say, pointing that there was something that could come if we didn't do certain things, something that will come. Then we started seeing the realities of it in small doses, but the projections, because we do make these projections. Statistically, Dr. Hines has been doing an outstanding job in being on the cases, which allow us to make the projections, which gives us an idea. If you keep adding 2 plus 2, you're going to get 4. And if you have 4 days, you're going to get 16. But if you multiply it by 16, you're going to get a certain number. So this is being done. I mean, it's not that we are doing it because of a scream and a shout outside. We monitor this on an ongoing basis. And it is the projections that allow us to be able to take certain interventionist actions. The projections that we had last time, and I must apologize for what happened last time, some of you in the national community, depending on what platform you were on, you would not have seen the gist of what Dr. Hines was basing his nervousness on. Because there is some technical glitch somewhere. Some people on, I think it's one of the platforms at Flow or TTT, something like that. But the months of March and April, which is where the projections were not visible to you. So while you were hearing what he was saying, and while he was drawing his conclusions, you were not able to see the data. I hope today that would have been rectified. I'm advised by my colleague, Minister of Communication, that it has been. So Dr. Hines will go through his whole arrangement again. But let me just say this about the disappointment I expressed. For God's sake, there's only one way to tell you that this is so. If I tell you anything else, that is either going to be inappropriate incorrect, untrue, irrelevant. We have been trying to share all the shareable information that we've had. As a matter of fact, what we have been living with is every time we take a suite of decisions, saying that this package of decisions, if followed, will cause us to be in a certain kind of position. A large number of people decide that their reaction to that is to seek exemptions from that, either officially, to be left out officially, or illegally, or just crazily. I can get away from that, if only to show that I can do it. Or that I am not sufficiently sensible to know that if I do that, me and my friends and my neighbors, and so eventually we get a big enough group in the population that undermines what we're doing. We have been monitoring our communities, especially our urban or semi-urban communities. We have been monitoring our response. It is impossible to assign a police officer to every citizen. We have 1.375 million people in this country. We have on any given hour of the day between 5,000 and 7,000 policemen in the country. It's impossible to police every person, so don't ask for that. It's not available. Also, even if it was available, it is not feasible to handcuff and manacle everybody who has infringed the law here and there, because you will end up with no place to put them and no courthouse to try them. So it's not feasible to go down that road. The road we have to go down if we are to escape is that we want a certain high level of cooperation, because this is a matter for the individuals. I woke up this morning holding back my own tears for that family where father and son in the same household within hours would have passed. Ladies and gentlemen, these are not numbers. These are people in families who are bearing that. The fact that nobody has died in your family is not an excuse to play the fool. And if we have to wait until it happens to us to respond, to protect us, well, then all would be lost. And it is my job to make sure that all is not lost. Imagine today reading a citizen saying, we're only getting information, but we want to see the dead people in the hospital to be convinced that there's COVID and it's causing death. You're serious? Well, I'm trying to avoid you seeing enough dead people in our hospital, but I have something to show you. Go and look at other countries that lost control of the management of COVID and see what that situation has produced. I don't know that we are disconnected from the pain and suffering that is taking place in India today. Our Commonwealth sister, our connection by virtue of our diasporic connections, and of course right in our own neighborhood here in Brazil. And I want to remind the people of Trinidad and Tobago, those of you who are obsessed with this border story. There are two CARICOM countries that are in close physical contact with Brazil. And those borders on those populations, they don't have fences, they don't even have security guards or even military guards in some instances. There's a freedom of movement in South America that Trinidad and Tobago cannot eliminate or disregard. And that freedom of movement, legal or illegally, comes all the way from Tierra del Fuego right into Port of Spain, because we are only 7 miles from Venezuela. We are part of the South American geography. So when there's a pandemic, we have to see ourselves exposed. And we are exposed. And not only exposed, but seriously threatened. What we have been doing is taking certain interventions, expecting them to be observed, and bringing us a pullback from the threat that is in front of us. I don't have to tell you, especially you in the media, because you have been seeing it, you have been reporting it. It appears as though calling on the population to do certain things have stimulated a certain kind of opposite response. Instead of responding in the way that we are to respond, to roll back the threat, in the last few days, it appears as though people have taken this to mean that the carnival that we lost in February, we're going to take it now. And what has been the result of that? As things go more difficult, become more dangerous, it becomes even closer and closer to the reality of a loss of control. I'm saying to the country, we have not yet lost control of our virus fight. But if we do not tighten the grip on what we know has to be done, we will lose the grip on managing the level of infection in the country. We're not prepared to allow that to happen. I could tell you, I'm amazed at how many people are taking the position. Yes, we know this has to be done. In fact, more should be done. But can I be excused from it, please? You have no idea. We from this podium, from this table, from the Ministry of Health and from the Ministry of Trade and Finance and so on, we have been trying to be as firm as we could with the protocols, first giving first priority to the preservation of life, but right next to that, acknowledging that we need to preserve some livelihood. And that is why, as I read the editorial today in one of the papers, they spoke about a confusion in the details of the restrictions. The reason for that is that so many people want a way out, an exemption, that to get anything done, you have to write the regulations as descriptively as possible. Otherwise, you leave out a whole lot of people who should be in because they assume an exemption. And I plead not guilty to not taking the population on board in this fight. We have been talking to the population. The only thing we have not been giving you is patient's name and who infected them. Everything else we have shared with you. And therefore, there's no more detail to come in terms of additional category of data. What is coming now is enough to tell us that we are in a worrisome place, and that is our level of infection, the rate of infection is much, much too high, and it will have a certain consequence. Unfortunately, those consequences would now have further negative impact on the economy, because what we are required to do now is further close. Further closures are required. And of course, continued enforcement. Hoping to be rescued from this situation by a dramatic turn in the behavior of the population. And for those who want to see the bodies, be careful what you wish for. You might not like what you would see. Because the person that you may have infected and killed might be right inside your own home. And for those who believe that in this pandemic, what is an essential is something that has the effect of exposing yourself to infection unnecessarily or infecting other people, I don't know that that's what you're saying to me. The fundamentals of our response as a country remains that we want to reduce the amount of people who are interacting with other people, and we want to restrict the amount of people on the move in the country. So, except for the absolute essentials of requirements to get food and water and electricity and pharmaceuticals and so on. And to keep the kind of livelihood to pay some of those bills, the rest of this country is to batten down for the next 2 weeks. I am here asking the Commissioner of Police, because I am not to direct the Commissioner of Police as to who he puts his hand on, but I could ask him to ensure that he and his men and women, who are now called upon to do even more than they were doing, to please encourage the population in all the ways you know how. Encourage the population that bad behavior has a consequence. Otherwise, the price that we are going to pay might be too high for the families that are going to have to pay them. I would like at this stage to ask Dr. Hines to tell us his story. And I hope that just confirm that the whole slide is looking well, right? Yes, Dr. Hines, you have the floor.
Thank you, Honourable Prime Minister. Good afternoon, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. We're starting off basically where we left off a couple of days ago, updating on what we've been seeing trend-wise with respect to the numbers of cases and the situations projecting forward. What we see right now is the total number of cases that would have been added to the cumulative total. So we had 291 new positives, and out of those 12,396 total positives, we have 3,236 active positive cases. Out of those active positives, we have 303 persons in hospital. The hospital figure is one of our concerns. While I'm not going to go through the rest of this slide in a lot of detail, just bear in mind that the more cases we get, the more active cases we will have, and a proportion of those will be hospitalized, so that hospital figure will continue to rise. As we move to the next slide, what we see is that epidemic or epidemiologic curve, bearing in mind that what we would see on the left-hand side would be from July, end of July into August, September, when we had our big peak last year. That now doesn't look quite as big, because as we look to the other end of our slide, which I hope we can all see, the right-hand side of the slide with the colorful bars going from green to blue to orange to purple, we see an increasing height of those bars, and the dotted line, that's the rolling average, running upwards, meaning that there's an increasing trend. So that increasing trend, that increasing height, is the cause for concern that we're currently speaking about, as we see larger and larger numbers on a daily basis. The numbers for May are reflected in that yellow bit to the right-hand side. And again, those numbers continue that upward trend. So the upward trend to date has not abated. As we move to the next slide, what we see is the weekly disposition of the same data. So instead of looking at the information on a day-by-day basis with a lot of fluctuation, we're looking at the totals from week to week over the same period, starting in July, moving through August and September in that gray section. That's the high part of the gray section being August and September, when we had that peak last year. And then we saw that downward movement. And now, again, looking at the right-hand end, week by week, the purple bars being the ones that represent April, we see that very rapid increase in the height of those bars. And the bar that's at the end, the first week of May, bear in mind the first week of May is not yet done. And this is data as of yesterday. Yet still, we have nearly reached the same figure as the last week of April. Also bearing in mind that the background, that orange or salmon, I'm not sure what color it looks like on your television, but that area in the background represents, if you look to the right-hand side, the percentage positivity, meaning the level of positivity, percentage of people out of 100 tests that we do, what percentage come out as positive for COVID, and that has climbed to about 37%. You see the upward trend throughout the time frame. Now, I want to point something out at this point, something that we haven't really addressed as an analogy before. We can look at this like a fire. the fire needs three things in order to burn. We need fuel. Unfortunately, the population is the fuel that was being burnt. We need some sort of heat. This positivity, this level of virus in the population is the heat. And the oxygen, the thing that makes this burn, is contact. People getting into contact with each other. If we want to stifle this, then we need to reduce that contact. That's how we're going to bring one of those three elements out of that triangle of combustion. If you look at the next slide, because people recognize and understand months better than epidemiologic weeks, we see that the gray section again, July, August, all the way through to December, with the tallest month, the highest peak for 2020 being September. Looking at January in green, February in blue, March in orange, we saw the downward and then slight upward trend, and then the big jump to just as many cases in September in April. So April and September, basically similar numbers of cases. Bear in mind again, this is the completed month of April, and the first week of May has more than half those cases. So the speed that we're going at, that upward trend, has not abated. Looking at the overall distribution, we've seen this before, we've seen it several times at this point. The overall population affected between July and now has a particular distribution where the majority of those persons are in the 25 to 49 age group. And if we just look at the April data, we see that that is basically still reflected. It's not a different distribution, same distribution of people in terms of age groups being affected, and it's about half male, half female. Looking at the deaths, however, we do see that there are a lot more men than women. And though we have a few extra, or there's an increase in the proportion of women in this recent time frame, it's still majority men. But the younger age groups, we're seeing greater reflection of illness and death showing up in those age groups. And when we talk about the clinical presentation, we will have a little more information on that. Now, these are the projections that we were speaking about that I believe did not render properly. Now we're looking at all the way from when we had the lull, April, May, June, starting in July, and then that upward trend, the first bit in August, and moving all the way to the right-hand end, we see some lines that stick out of the top of the, or the end of that graph, and those lines were projections made at different points in time. The green one, which is the one we're going to focus on, the tallest one, is a projection made using the rate from the end of April, last couple of weeks of April, looking at the 14th to the 28th. And at that point in time, we made a projection that the cases will rise by a certain amount over a given time. And we see that we're actually exceeding that at this point in time. We're going to zoom in on that. So we see where the blue bars representing cumulative totals on a daily basis are actually higher than the projections that we made using the rate from the end of April, meaning that we are continuing to pick up pace as opposed to slowing down. Again, this is the cause for concern. If we look at the active cases, that body of people from which the hospitalization is driven, we see this green line that is running from left to right and curving upwards. That green line continues to curve upwards at exactly the same speed as it was doing at our last update. So we do see a line saying previous update, meaning the last time we spoke, this is where we were, and we have not seen any downward curve in the number of active cases. It's continuing along exactly the same projection, and it's heading towards very large numbers in a very short space of time if braking force is not applied. And when we look at the number of people who will be hospitalized, those currently in hospital, and those who are going to be hospitalized if we continue at this rate, we see that this purple line, which then overlaps with a red dotted line, that's the purple line being current hospitalizations, and the red dotted line being the projected hospitalizations. We're continuing again along exactly the same curve. No slowing at this point in time, and in fact, there may be a little bit of an acceleration, meaning that the projected date that we gave of 7 to 10 days may actually be shorter in terms of reaching the maximum hospital capacity. So this is the trend, this is the situation as it stands, and this is the concern that we have, that at this pace, we're going to run out of the space that we need to take care of the ill population. I'm going to leave it there, and I'm going to turn you back over to the Prime Minister.
Thank you very much, Dr. Hines. CMO, could I ask Dr. Richards now to tell us about our hospital situation?
Good afternoon to the Honourable Prime Minister, the Honourable Ministers of Health, National Security, Energy and the Office of the Prime Minister, and the Minister of Communications, Chief Medical Officer and colleagues, Dr. Hines and Dr. Trotman, members of the media, to the listening and viewing public. Thank you for joining us at today's media conference at the Diplomatic Centre. I come to you this afternoon to speak to you on an issue of national importance. That is the status of the parallel healthcare system, the Ministry of Health's response to the COVID-19 pandemic. Before I provide an update on the status of the parallel healthcare system, I would like to recognize the efforts and work of every frontline worker from the public and private sector who has worked tirelessly and selflessly to support and ensure the continued operations and resilience of the parallel healthcare system. That is a system that covers all aspects, starting from the exemption process, repatriation exercises, the treatment of ill patients and suspected patients, and now vaccinations and contact tracing. Thank you so much to our national team for your human service to country. This afternoon, I would like to share up-to-date information that was provided a few days ago on the parallel healthcare system, specifically the situation at our hospital and plans to increase the overall capacity within the next 48 hours. My fellow citizens, I will start by reminding each of you that health is a public good and a key indicator of national, regional, and international development. COVID-19, as we all know, is the great equalizer, irrespective of our age, gender, and social class, and we are certainly not immune to the ravages of this terrible virus. I'd like to start by sharing information and statistics that are accurate as of until yesterday afternoon, and I'll give some updates as to the statistics today. So the parallel healthcare system has 7 hospitals across Trinidad and Tobago, 5 in Trinidad and 2 in Tobago, inclusive of the St. Anne's Hospital, and at current, 6 of those hospitals are operationalized with patients. There is a total capacity of 542 beds across Trinidad and Tobago as of now, with 436 beds in Trinidad overall. Now, this is important for us to recognize because we have been looking at information that has been aggregated between Trinidad and Tobago. However, realistically, when we are looking at occupancies, we need to consider, obviously, Trinidad separately from Tobago, because the feasibility of movements of patients and so on would be very difficult if we had to do inter-country transfers. As such, I'll provide information, especially on the Trinidad situation, where the occupancy levels are very high at this point in time. I'm now going to look at the new cases and 7-day averages, which is the first slide in this presentation. As you can see, the rolling averages, as Dr. Hines would have indicated, have been increasing, and the rate and trend at which it is increasing has resulted in a rolling average as of today, this afternoon, of 271 cases. Now, it's important to note that the more cases we have, the more need for hospitalization and the demand for hospital beds. If we look at a continuation of the graph that I shared on Monday, we will notice an increasing trend in terms of the admissions that we are looking at. And when we look at the admissions and discharges there's a net increase in the amount of persons at each hospital. Now, you would look at the overall new cases as being black, and there was some variation this week, somewhere between a max of 399 and going down to a low of 174, I believe. And when we look at the number of admissions, we are seeing that trend generally increase with the exception of one day, while the discharges have actually decreased. That is indicative of how ill patients are, and my colleague, Dr. Trotman, will go into more detail on the clinical perspective as far as that is concerned. Now, what is important to note is that over the last week, we have been tracking the admission and discharge rate. Last week, we found that 14% of persons of positive cases needed hospitalization and required care at a hospital. This week, we have seen that number increase to 18%. The discharge percentages as of last week was 6%. So it meant that for every 100 persons who had COVID-19 and were confirmed, 14 of them required admission. And when they went to hospital, 6 of them would be discharged, which led to a net of 8 persons per day for every 100. Now, what we found this week is that it's an 18% increase in terms of the hospitalization required and a 3% discharge. So we are now moving towards 15 per 100. Again, this is tied to the clinical course of the disease and just really demonstrating how ill persons with COVID-19 are and the longer recovery times, which means they occupy beds for a longer time. It means, therefore, that when we were looking at a net of, say, 30 patients last week requiring admission on a daily basis, spending anywhere between 3 days and 21 days in our hospital, we are now looking at a net actually of 18 minus 3, which is 15 patients. Now, given a rolling average of 271, we are looking at close to an additional 40 patients a day in a hospital system in Trinidad and Tobago, where the bulk of patients are being hospitalized with a total capacity of 436. I'm hoping that everyone is identifying and recognizing the inveterate ramifications of this continued trend in terms of the number of cases. So again, this demonstrates the daily admissions and the rolling average again increasing and basically correlates with Dr. Hines' presentation, but from a more operational standpoint. Again, we've seen the admissions versus date, and if you look, it's an overall increasing trend in terms of admissions. And I'd like to share with you some statistics as of 10 a.m. this morning. The Cora Hospital, which manages a certain level of patients, that is, those who are moderately ill and may not need ICU and HDU care, is 98% filled this morning. 98 patients. The maximum capacity is 100. So we can count that hospital as being filled. So if you had a relative who is unwell and has diabetes and hypertension and is elderly, but walking around well and we consider to be one at risk of deteriorating, there is no space at the Cora Hospital. Let's talk about the Couva Medical and Multi-Training Facility, which is now 75% filled. And yes, we have 40 additional beds, but as I keep emphasizing, a bed is not a bed. We do not have the supporting human resources to manage these beds. And we are looking at other factors, consumables, personal protective equipment, and even ventilators. Because a ventilator is not a ventilator. There is tubing, there is specific care, there is the management and calibration of that ventilators. So the discussion and the narrative that we have all these beds in the system needs to be done with caution, considering all the variables that support them. At the Augustus Long Hospital this morning at 6 a.m., we had a bed capacity of 45 beds spread across HDU, ICU, and ward beds. At the time, we had 38. By 10 a.m., the entire Augustus Long Hospital was filled. So right now, we are at 44 out of 45 patients. Again, this hospital that houses persons from the south part of our country is now filled. The Arima General Hospital, recently recommissioned as a COVID-19 hospital as of last Saturday, currently at 60%. We can increase the number of beds there, but again, we are limited by human resources and working towards increasing that the capacity of the hospital. So we are seeing an increased demand for beds across the entire parallel healthcare system. Now, I disaggregated Trinidad's occupancy from Tobago's occupancy to highlight the importance and the severity of this continued trend. And you can see the total occupancy being a blue line and generally increasing with some spikes, which correlates to a 24 to 48-hour gap after the cases that were running in the 300s this week. And you would see that the Trinidad occupancy continues to steadily increase. Right now, we are at 70% overall, which is the highest we have been since March 12, 2021. Now, how do we decrease the demand on our hospital beds? We are doing a two-pronged approach in terms of a follow-up plan in the next 48 hours, which demonstrates the interoperability and the resilience of the parallel healthcare system. But we are testing that system, and we do not want it to fail. So in terms of a contingency, I'll just summarize because the Chief Medical Officer and the Honourable Minister will go into more detail. We are increasing the number of beds at Augustus Long. It's 7 additional beds, but those are 7 additional lives, 7 additional mothers, daughters, parents that can be helped. The CEO of this SWRH and his team have already mobilized nursing personnel and all medical personnel to increase this bed capacity by 7 within the next 24 hours. At the Arima General Hospital, where we can actually move from 60 beds to 120 beds, given the physical configuration of that hospital, we are increasing the capacity on a phased basis using human resources that are being deployed and shared from the other RHAs. A similar exercise will occur at the Cuba Medical and Multi-Training Facility. We have also introduced an additional care level, which is an enhancement of our existing step-down facilities, with 30 additional beds being added this evening and a maximum capacity of 90. At the UTT Valsain, a similar exercise with 30 additional beds within the next 24 hours and a maximum capacity of 190. We also have plans at the Tag-Harigua Extended Care Facility to increase the bed capacity within the next 48 hours. As such, we are increasing the number of treatment beds for patients by 60 beds within the next 24 hours. And Dr. Trotman will go into details regarding the clinical criteria for these halfway houses, as the Honourable Minister referred to them, between patients being ill and requiring hospital care and those that can walk around but need oxygen and less monitoring. Now, we looked at the supply side, how there's a demand and we're increasing the supply. But there's a conversation and a narrative that we need to shift to, and that's one of personal responsibility. Now, the vast majority of our population are civic-minded and law-abiding, responsible persons. And we need to continue to collaborate to protect and support each of us and our family as we exercise personal responsibility with regards to the 3 Ws. Now, we've been doing generally well with the proper wearing of masks. We're afraid of the police. We're afraid of the enforcement. We have been washing our hands and sanitizing at every facility. But we need to watch our distance. Let us stop the commingling, the congregation, the mixing, because we all have different exposure levels, even though we may come from the same family. We are exposing our parents and our sisters and brothers to COVID-19 in a system where we have basically barely any beds left at most of our hospitals this evening. This is just a trend with the total occupancy. You'll see Tobago is petering off at this point in time, but things can change, and we have had increased cases within 48 hours that changes the entire demographic of that graph and direction. And this is one last slide that I wanted to highlight to you about the impact of this situation. And it regards the ambulance system, which, we consider, but we don't realize how it's been impacted. Between the 1st of March and the 5th of May, we have seen the percentage of persons who require ambulance care for COVID-19 increase to 47%. Last week, Thursday, the system was overwhelmed. On Wednesday, it was again overwhelmed. And what is the impact of that? The impact is that if a person, a pregnant mother, an ill child, requires medical attention and contacts the ambulance service, there's a delay because the transport or transfer for COVID-19 patient has a longer turnaround time. There is a need for sanitization, increased PPE, so the turnaround time has increased. And this is just a simple graphical representation of the impact of the COVID-19 pandemic and the increase in cases. Ladies and gentlemen, fellow citizens, on behalf of the Chief Medical Officer, Dr. Hines, Dr. Trotman, and every one of my frontline staff and our staff, this afternoon, I would close by not just speaking to you as the Principal Medical Officer and a Ministry of Health staff. Today, we speak as physicians who view every single case as a patient, a mother, a father, and a sister. I speak to you as a daughter and a sister and a friend. And please, I am asking and appealing to everyone in the population to please give your mother the best Mother's Day gift ever. Let's give our family and our mothers a chance to have another Mother's Day. Let's continue to practice the 3 W's. Let's watch our distance and avoid the commingling, the dirtiest word now in public health, the congregation, the mixing, the bubble concept. Let's wash our hands and continue sanitizing, and let's wear our mask. Thank you once again for the opportunity to provide this information, and may God bless all of you. Thank you.
Thank you very much, Dr. Richards. I would like at this stage to ask Dr. Trotman to give us a presentation on the clinical experiences at the hospital.
Honorable Prime Minister, ministers, colleagues, Dr. Hines, Dr. Richards, members of the media, members of the listening and viewing public. I come with a heavy heart because the description in the clinical setting is one that touches each and every one of our souls. We are now seeing a picture of a patient that is different in the peak that we experienced before. And that patient is somebody who most of us would know. It's a 30-year-old, a 35-year-old, a 40-year-old who is coming in very ill. That is in contrast to our more elderly patient that we saw before, that would come in moderately ill or mildly ill as the proportion. The vast proportion of our patients are now coming in very ill. What is of note also is when they come to us and we get into their histories, we are finding out what we do not want to hear. That many of them were involved in parties, in gatherings, in situations where at work they would have been in the cafeteria without their masks, eating, and then afterwards staying and congregating. These patients, when they are ill, volunteer a lot more than when they are well. Because quite frankly, it's frightening. You enter after you are ill, a point of fear. I do not want the narrative to become, instead of I know somebody with COVID, I know somebody with COVID that died. That's a different narrative. And for me and the rest of our healthcare workers who took the Hippocratic oath, we are here to save lives. You can help us save your life by doing simple measures which we have been trying to enforce, but now we are saying it's absolutely mandatory. That now that we are facing a disease that is spreading in such a way that it is taking away the future of our country. I don't want us to have to say next, it's the 20-year-olds and the teens, because as we all know, it is and it can affect everyone. Clinically, we are seeing patients who are not only more ill, but they are taking a longer time to get better. So I know the solutions that are being put in place will work with your help, only with your help, because we are now putting in different tiers of care to assist and to encourage that we now and facilitate more of those acute beds and allow less sick patients to go into situations where they can be managed, but not without your help. The other scenario we have to keep in mind is that the management of a sicker patient with COVID is not the same as the management of a sicker patient who doesn't have it. In the run of our day, you have to not only take care of the patient, but take care of yourself to allow that you could come back to take care of more tomorrow. And it means that the sanitizing processes that we have to go through for each patient impacts how long and how we can affect, how quickly we can get to affect and make an effect for these patients. And that goes, as we mentioned, not only for the patient, but for every single aspect of this care. So what I am painting for you today is a clinical scenario at our facilities that involves a younger set of patients, sicker, taking a longer period of time. And I know that we can do this. I know that we can make this right with everyone on board. But I want you to also think about the challenge it is for our healthcare workers that are doing this day in, day out, second in, second out. We may not be that person's mother or dad, but it's our patient. It matters to us that they get better. And when they don't, it has a psychological effect on us, the healthcare workers. I have to thank Professor Hutchinson and his team for building in that psychological support for our healthcare workers. I want you to also think about those things that we don't talk about also in the care of the patient is also the care of the healthcare worker. And I want to thank each and every one of them. They are given of their life, soul, and blood in this pandemic. I want you all to remember to distance, sanitize, mask, do not congregate. Thank you.
Thank you, Dr. Chapman. CMO, in light of what has been presented, I would like you now to take the podium and tell us what are our responses in terms of increased capacity, both human and physical capacities.
Okay, thank you, Honourable Prime Minister, Honourable Ministers, members of the media, members of the viewing and listening public. So, if I could try to summarize what has been said, we have been fighting this battle now for over a year. We have seen different phases, if you want to call it phase 1, phase 2, phase 3 of the virus in Trinidad and Tobago. And we compare this particular phase to phase 2 because it seemed very similar at the outset. When we looked at it, we saw some congregational behavior for a couple of weeks and we saw a spike, which we saw in July, August, and September of 2020. The difference is, and I want to point out the difference between this spike and the spike of last year, is that persons, one, there's a law that says you have to wear a mask to cover your nose, mouth, and chin, which we did not have in August of 2020. Considering that we were able to control the way this disease spread and this virus spread in our population by our personal responsibility for quite a long period of time in the first 3 months of this year. The masking is not there as law to be punitive. The masking is there to save your life. It has nothing to do with the law. We need everyone to mask. Masking has been a considerable public health good to Trinidad and Tobago and other parts of the world, and it alone, if it is done properly, can bring our control back to where we want it to be. Unfortunately, I don't think the masking is where it needs to be. The behavior of people is not where it should be. And the changes, and as Dr. Hines pointed out in his graph, that we expected to see by putting the measures we put in place last week, the week before, and the week before that, has not borne significant fruit, because obviously it has not resulted in the change in behavior that we expected to see. There's continuous congregation. The mask, if it is not worn, although it is law, it will not work. And we have seen that it is not working. We can see that in the numbers. It requires, we are at this phase. If you remember the de-escalation plan of 2020, at this phase we were probably at phase 2 to phase 3 of our de-escalation plan, which is a significant lockdown for a country. We have to bear in mind, all things being equal, as the virus continues, that it requires more. It would seem that the virus is behaving differently. Dr. Trotman would have pointed out the clinical picture that we are seeing. We are seeing the way it is moving. The transmissibility is much higher. It all points to, of course, we know that the variant is here for a few weeks well, and that commingled with the behavior of people has led to the escalation we are seeing. What it requires is a greater braking force. For Newton's third law says, for every action there's an equal and opposite reaction. It requires a similar force in the opposite direction to stop this force from going forward. We have hope on the horizon, and Minister will go into it in terms of the vaccines in a short while. I think we would have seen news about Sinopharm. So I think the vaccines, together with the measures that we put in place today, will hopefully bring us back to a position where we can be at least comfortable in the next couple of weeks. Thank you, Prime Minister.
Thank you very much, CMO Dr. Paraswan. I would like now to ask the Minister in the Office of the Prime Minister to go into the details of the adjustments that we are going to make today, which will come into force at midnight tonight and be in force for the next 2 weeks, in addition to what we have already placed on the table. Minister Young.
Thank you very much, Prime Minister, Cabinet colleagues, CMO, members of the medical team we've been working with closely for the past year, members of the media, wider viewing and listening public of Trinidad and Tobago. Good afternoon. I think the best way to, Prime Minister, to summarize the decisions that we've taken, that we're about to announce, is to remind everyone where we were last year, April, coming out of March, at the end of March last year. And the phraseology we used was work from home, stay at home. That is the mode that we're going back into. So basically we're asking everyone to stay at home. We're asking persons, if you can, to work from home, save for the exceptions that I'll spend a little bit of time going through as quickly as I can here. We're currently settling these regulations, which will be published, and as the Prime Minister said, they kick into force from midnight tonight. And the time frame we're looking at for all of these things are from the 8th of May to the 23rd of May. So we're sticking with the 23rd of May. So work from home, stay at home. Additionally, all of the establishments that we're granting exceptions to continue to operate, to keep everyone alive, are to be closed at 8 p.m. I got a disturbing message on the way here earlier today that certain gas stations, for example, were advertising, we are open until 10 p.m. and we sell alcohol. That's not the type of behavior we're looking for. I'll start by saying public transport, we've taken a decision that public transport is to go down from 75% to 50% from midnight to night. We're also saying that persons should not be at any workplace unless you're specified in the list, and I'm not going to get into every single item on the list. It's similar to last year, but I'll pinpoint the main ones, and of course when we publish the regulations you'll see. So you're at any workplace unless specified, and shall where from possible work from home. We're also keeping the number of persons gathered in public places at 5. Of course, this does not apply to some of the institutions we're allowing to be opened, for example, banks, groceries, where we know there are going to be lines outside because we've limited the internal movements in these institutions to 50%. So outside of banks, groceries, pharmacies, we're asking, please, socially distance. As the CMO pointed out, the wearing of masks remains mandatory and can attract a criminal fine, a criminal offence, criminal charge with a fine. What we're saying is as follows. These are some of the exemptions we're granting and what we're calling essential services. The operations of the judiciary, magistrate, Supreme Courts of Judicature, Industrial Court, the Environmental Commission, Equal Opportunities Tribunal, Tax Appeal Board. Legal services continue. Sittings of the House of Parliament and meetings of Cabinet or any committees thereof, sittings of the THA, meetings of the Assembly, any committees thereof, operations of the Diplomatic Corps. Primary emergency services remain. Of course, our state and private emergency ambulance services, all emergency call centres, our Trinidad and Tobago Police Service, the Defence Force, Fire Service, Immigration, our intelligence services, and then basic essential services, janitorial maintenance services concerning the provision of health, hospital, water, electricity, fire, sanitation, civil aviation, telecommunications. The workers in WASA, the workers in TNTech, our health services, of course. One of the distinctions with our health services is we're only going to be allowing the urgent provision of dental, ophthalmologists, physical therapy, occupational therapy. So that is one area we're pulling back a little bit and saying that only emergency services for dental and ophthalmology and occupational and physical therapy. Essential janitorial and maintenance services for private condominiums, townhouses, residential homes, public and private facilities. These are essential. We have taken a decision that I'll come to in a short while with respect to our domestic workers and gardeners. Unless you're living at the residence, we are also putting a hold on that for the next 2 weeks. The prison services, children's homes, private security firms and estate constables, special reserve police or municipal police, essential as you would expect. Social workers and that whole blanket of workers to provide the social services will be allowed. Caregivers, workers providing services at hardwares, including electrical and public plumbing establishments, of course, closing at 8 p.m. Financial and insurance services, and that suite, which are spelled out here in the regulations, will be permitted. But again, with the proviso, only those who are required to come out. So even in these essential services, we're asking that only the essential workers come out and the rest of us stay at home. Live-in domestic workers only. Service providers who provide services that are necessary to maintain the safety of sanitation and essential operations of residences, such as plumbers, electricians, exterminators. Again, these are on a as-needs basis and emergency services. We are allowing, of course, those the plumbers and electricians to go to persons' homes, etc. Retail services. Retail services we are allowing, and we have taken a decision after consultation and after a number of representations to the Prime Minister and the committee. Discount stores. Unfortunately, in the last 24 hours or so, or less than 24 hours, we've had some type of behavior that concerned us, where we had said certain discount stores, those that were membership stores, should pull back because we were having large gatherings of people. As we've heard the doctors tell us over the past year, this is what we're trying to avoid, the congregation and allowing the virus to spread. We've taken a decision that we will allow these facilities, and one of them being PriceSmart, to operate, but only to sell the grocery items and the food and essential services items. We're asking them to work along with us because it's for the safety of persons, and at a 50% capacity. So they are included. So in retail services, we're allowing that. We're allowing markets, supermarkets, fruit stalls or shops, vegetable stalls or shops, bakeries, pharmacies, and parlors for the provision of food, medicine, and other necessities of life. We've found that over the past few weeks, few months, everyone is trying to find a way, as the Prime Minister described. We're asking, please don't try to find the loophole or to break the law in these areas. It's for our own good. All of these establishments are to be at 50% capacity inside, social distancing outside, and the proper type of behavior. Wholesale stores for the provision of food, medicine, or other necessities of life. Ministries, again, all of these things is only those who are required to work. We're allowing manufacturing, transportation, logistics services for certain areas. We are taking a decision to only allow for emergency automotive repair and maintenance facilities. So not every garage is to be open. We're not asking persons to go now and lime in garages whilst your car is being fixed. It's for emergency services, because I can't emphasize enough. We're trying to get everyone to just stay at home, stay put till the 23rd of May as much as you can and reduce the movement. We're allowing the manufacturing of and distributors of food and beverages, pharmaceuticals, including the packaging and bottling of these items. So manufacturing that falls outside of these areas, for example, of certain other types of goods and services, we're asking, please work with us, and for the next 23 days, sorry, not 23, until the 23rd of May, just stay at home as well. And we have in here the types of employees to maintain aircraft, marine vessels, and those types of things, similar to what we had last year. We'll provide it. Of course, workers supporting newspapers, media houses are essential. Services relating to food, beverage, agriculture, and fisheries. We are not allowing, as we had rolled back already, the takeout and curbside of restaurants or in-house dining. A new phenomenon, of course, has sprung up, and we're aware of it, and the police are aware of it as well. Unfortunately, some restaurants, some of these establishments are trying to, again, get around what we're trying to do, and they're offering delivery services. We're asking, please, that is not allowed. It is not exempted. So restaurants who want to provide delivery to your homes, just think about it for a moment. The same delivery driver that you're sending out there, you're exposing him or her. If him or her is exposed by coming to get the virus from me at my house and then moves on to X, Y, and Z after me, that is a spreading event. So we're asking restaurants, just please stay put until the 23rd of May, including this attempt at a delivery service. It's not permitted. Food and beverage manufacturers and employees, supplier employees, we've listed it. We're allowing farm workers who are employed in animal food, feed, ingredient production, packaging, etc. Of course, because that helps our food production. Workers who must look after and feed animals at zoos, farms, or animal shelters are permitted. We're allowing fishermen, of course. And you all will see the list all associated with the agricultural sector, the food testing labs, pesticides, and these types of things. We then get down to workers engaged in the production, manufacture, supply of medical supplies and equipment, and the servicing and repair of medical equipment. We've added, and other services specifically provided to the medical sector. And this, of course, includes both public and private medical sectors, because we need that to stay fully operational during this time. Workers who are providing wholesale supplies for groceries, supermarkets, parlors, other similar shops are permitted. Of course, the energy sector remains alive, and we've listed in a very great detail, almost 2 or 3 pages of everything in the energy sector to allow it. But again, even in the energy sector, there's some workers who can stay and work from home. One of the things we're going to be putting in here that's different to last year, the petroleum stations and convenience markets, convenience marts attached to these gas stations, as we call them in Trinidad. We're also probably going to close those at 8 o'clock at night as well. Or we may keep the gas stations open and close the convenience marts. That will come out in the regulations. We then go along, hotels, guest houses, eco-lodges are allowed, the seismic research unit of UE is allowed. We have specifically taken out at this time all construction. So on the last occasion, when we were at this stage last year, we said construction of health services, QREP interchange, other things. We took a decision this morning based on the advice given to us by our health personnel. All construction is to cease until the 23rd of May. All construction. This is a large movement of people, and we're asking everyone just put pause until the 23rd of May. And really, that captures it. Captures the vast majority. I mean, there are a lot of specifics in here. We will publish it within, hopefully, the next few hours, hopefully by sometime tonight as we just complete working on it. And then again, we emphasize here that this only applies to persons who are essential to the exempted essential operations and those who cannot practically work from home. And this, of course, is from the 8th of May, which is tomorrow, until the 23rd of May. And I think that's as much detail at this stage, Prime Minister.
Thank you, Minister Young. I would like to ask the Minister of Health to come in at this stage and tell us where we are with respect to our vaccination response.
Thank you very much, Honourable Prime Minister, Cabinet colleagues, Chief Medical Officer, doctors, ladies and gentlemen of the media, listening and viewing public. Prime Minister, I paid special attention to the tone and tenor of Dr. Trotman's voice and the Chief Medical Officer's voice. The words I could use to describe their presentations today and their voices was that they were somber, the tone was dark, solemn and grave. It is the same way I felt this morning driving into Port of Spain and taking the route next to the Brian Lara Promenade. And I wept. I really wept when I saw what was taking place at the Brian Lara Promenade this morning at 8:30. A total disregard for the public health measures. It was sad. I pulled aside and I literally, a tear came to my eye. It did. We don't know what else to do to get the man in the street to understand how severe this is, but also how important their role is in combating this virus. People on Brian Lara Promenade, I have no problem with people drinking the White Oak and Coca-Cola at that time in the morning. But do it home. Don't do it on Brian Lara Promenade, sitting next to each other, a foot apart with your mask off. Congregating in 10s and 20s with your mask off around a bench. That is not what we need right now. We need to see our streets clear, our parks clear. So I just want to make that appeal and hope my tears this morning did not go in vain. Right, on the issue of vaccines, as you know, we got notice yesterday afternoon that COVAX will be delivering 33,600 doses of vaccines to Trinidad and Tobago next week. This good measure, that now means that if we use that 33,600 together with the reserve we have from the 40,000 gift from the government of People of India, we could now fully vaccinate for the first time 60,000 persons in Trinidad and Tobago. You may recall when we got in the initial shipment of 33,600 with a short expiry date, there was talk then of only using half, only vaccinating 17,000. That went up to 45,000, then it went up to 60,000. So we have actually vaccinated 3.5 times more than we thought we could have. And that's an excellent place to be. So we got word this morning now, firm date of arrival next week, Monday at 5:30 p.m. So I will be at the airport together with Dr. Wheeler of Paho and so on to receive those vaccines. On the issue of the Sinopharm vaccine, let me go into some detail. There were 2 Sinopharm vaccines before WHO for emergency use license. And let me just take a minute to explain what emergency use license is, so you don't think it's a shortcut. When you are evaluating new drugs, you go through different phases. Preclinical, where you test on animals, then phase 1, you test on a small amount of people, phase 2 and phase 3, when you test on large amounts of people. Emergency use authorization means WHO takes phase 2 and phase 3 trial data, which is on huge numbers of people, look at their safety data, their efficacy data, and then they authorize this new vaccine in times of a pandemic. I want the population to understand this is not the first time that this is happening. This actually happened with the Ebola vaccine, which was experimental. But when they were doing the trials, they found in the middle of the Ebola pandemic that people were surviving. So WHO granted EUL, or what is called compassionate use, for the Ebola vaccine way back in 2014, 15, 16, until the Ebola vaccine finally got approval in 2019. The point I am trying to make, EUL is a part of normal procedures within a pandemic. So that is how the Ebola pandemic was able to be managed, by EUL for the Ebola vaccine. Similar thing now applies to the Moderna vaccine, which got emergency use authorization last week, Friday. AstraZeneca, which got it on February 15th, and Pfizer, which got it December 31st. So Sinopharm had 2 candidates before WHO. Sinopharm Beijing and Sinopharm Wuhan. The vaccine that has been approved is Sinopharm Beijing. And that is the same vaccine that the Honorable Prime Minister would have had talks with his counterpart in China on March the 16th. So the gift of 100,000 doses will be on its way from early next week. All the preparations we had in place have now swung into action today once we got approval. Cabinet note signed, letter of commitment signed, everything gone to the Chinese embassy, everything. So the Ministry of Health is now working with the Chinese embassy and the officials there to operationalize the plans, which have been there for weeks now. So that is where we are. I just want to make a last plea. Sunday is Mother's Day. And I want to reiterate what Dr. Trotman said. If we treat Mother's Day as another excuse to gather at the homes of our mothers, and I think Dr. Richards went into it, we may not have those mothers for Mother's Day 2022. We are appealing to children who want to go home by their mothers. Think twice. If you live with your mother, that's okay, but don't have gatherings where all the children come, all the grandchildren come, all the aunts come, all the uncles come. That will do a disservice to the health sector, already strained, but it will do an ultimate disservice to your mother. If you love your mother, Mother's Day 2021 is the Mother's Day where you show love by staying away as much as you can. So those are my exhortations this morning, and that is where we are with vaccine procurement. Let me just say, outside of the 100,000 doses of Sinopharm vaccines, we are already in talks to purchase vaccines on a commercial level from Sinopharm in the order of hundreds of thousands. So it is our intention with that to vaccinate ourselves out of this pandemic in the shortest possible space and time. But whilst we are vaccinating ourselves out of the pandemic, the public health measures still apply, and the personal responsibility in your homes, in your not to have parties, as Dr. Trotman is saying, people are now making deathbed admissions. I had a party, I went to a party, I had a gathering, I went to a line, which we don't pick up in contact tracing. But people are now making deathbed admissions that, yes, I congregated, I went to a party, I went home by somebody. So we have to continue these measures for the foreseeable future, but there are brighter days ahead, but we must, at this point in time, shelter in place. Thank you, Honourable Prime Minister.
Thank you, Minister Dayal Singh. I want the population to be advised that the management of this very complicated issue falls to a number of ministries working as a team. And those ministries are the Office of the Prime Minister, the Ministry of Health, the Ministry of National Security, the Ministry of Finance, the Ministry of Trade, the Ministry of Agriculture, and the Ministry of Social Services and Family Support. Because their actions, reactions, and consequences. Having indicated to you now that we are not excitedly going into further restrictive operations, which you loosely call lockdown, I just want to mention that I didn't hear Minister Young speak about the energy sector in the list that he called out, in the exemptions. Let's remember that throughout, from the very beginning, we have the energy sector being our lifeblood in the way that it is, had the distinction of being left undisturbed. So all the people who are involved in the energy and energy support services and so on, your exemptions remain to continue. But of course, it's even more important now for the strict protocols that prevailed in the energy sector to continue so to do. So I just wanted to add that. Now, the next question that I expect is what is going to happen to the people who have lost their livelihood, those people who are not able to find the basic resources to keep body and soul together. I did indicate at the last outing that the government will try as logistically possible to identify those persons who are not able to cope with feeding themselves, not with maintaining their lifestyles. But basically, the government's responsibility here is to try and ensure that as far as is feasible, to identify the qualified persons, ensure that families are fed at a reasonable level, and that those persons who are at the lowest end of the economic scale, who would have been jolted by this intervention to protect the rest of us and themselves, that they get the assistance of the taxpayer in some form of assistance. So that is going to come. As I speak to you now, and for the last couple of days, the Minister of Finance has been working on that. He's working on it now, and he will speak to the country on Monday. And the publications of the qualifications and so on will be published, I hope, on Tuesday. So by the time we get a little further along, people will begin to receive some form of assistance, largely towards sustenance. And we are hoping, we are still hoping, because I'm an optimist, that we will have the kind of response that is required, that this kind of intervention does not last for too long. We are aiming here within the original date of May 23rd, but let me ask you, if the behavior continues, the disregard continues, the don't give a damn continues, God is a Trinity continue, not me but he, if that continues, what decision do you expect me to make on the 23rd of May? I throw that out for your consideration. I don't need an answer. So the Minister of Finance will provide some assistance, and he will give the details, and with him, working along, will be the Minister of Social Development to identify where that help, that support will go. And we would marshal resources from wherever they are available to us. I mentioned before, not on the scale that we did last year, because that is not available, but certainly on a scale that would keep destitution from being part of the portion of the persons who are directly affected. And I want to say to her, it is not everybody who is affected by this intervention that is a basket case. That is not the story. Many people are being called upon to carry yourself on your own resources for a little while, and we're hoping it's a little while. But the people that are going to fall to the social services are the people who do not have that ability to carry themselves, because they basically were living from paycheck to paycheck. So if you remove the paycheck, they don't have the ability to keep themselves going forward with dignity and the kind of sustenance that's required, especially where children are involved. It is my commitment to this country that wherever children are involved, the last of our resources will be used, if it comes to that, to make sure that our children do not fall to a place where their future is extinguished. Having said that, I am still holding the Minister of Education and her team to the SCA exams that will take place on a particular day. If as we approach that day the circumstances are woeful and awful, then we'll cancel. But as of now, we want to relieve the children of that uncertainty, that stress that is don't know, may not know. The definite date is that we're going to work with that. Basically what it is an exam that they'll go and do and go back home. That exam will allow us to assign them to schools in the next school year when that school year comes. I've seen advice, and we've got a lot of advice from some quarter, that we should abandon the exam. As a matter of fact, some people even say we should take the opportunity and abandon the SCA exam totally. But it's the next paragraph, it's the next phrase that I was concerned about. And then think about what to do, having abandoned the SCA as an exercise. That is not in front of us at the moment. What's in front of us is to try and preserve the situation where we'll be able to advance the children to the next year, school year. Because if we cancel the exam, then we'll have 2 years of children in 1 year. And that is the problem that we'll be called upon to fix. But I think we've done enough during this difficult year to have the exam so that we could smoothly do the selection for the next year. And based on the information we have now and the resources we are having now with respect to vaccination, it is my expectation that the improvement should start in June. The exam is in June. And of course, the school year in September. We should be in a position in September to talk about whether or not the children go to school. Hopefully, our prayers will be answered and our actions will bring reward, that we may be able to be in a position to start a school year, if not in September, soon after September. So that's where it's at for the moment. The Minister of Agriculture, as I speak to you, that ministry working through NAMDEFCO, and taking the policy position that we will seek to provide as much food as possible to those who need it most. Already, The minister reports to me today that we already have 2,000 packages of food through NAMDEFCO ready to go out, and the target is that we would aim to provide 25,000 of those packages. But there may be a little change for the better in the diet, because let me tell you what the packages will contain. Sweet potato, dasheen, cassava, plantain, squash, pineapple, citrus, pawpaw, cucumbers, bodi, peppers, tomatoes, and some chicken. So, ladies and gentlemen, 25,000 of those will go a long, long way to help the neediest alongside what else would be available. And of course, there was a commitment to ensure that those who are already on the social support systems will be financed and supported. And with respect to these food packages, we'll use the same system we used last year, asking our 41 MPs to assist in identifying to the social services department the neediest persons. And I did mention last time that we will advance some funding to the churches and other religious bodies to assist in this program that's going on. Let me just say one other thing, and that is the vaccination program that is on the way is not an exemption, because it looks as though we are in a better position now with respect to being able to access more vaccines from a new or additional streams. The vaccination is not an exemption. I am convinced that the laxness that descended upon this country in the last few weeks, starting in mid-March, was influenced considerably by vaccine wariness, by COVID wariness, where people believe that the coming of the vaccines, one, a lot of people refused to accept that vaccines were not available to us. And therefore they believe that some of the old talk they were hearing, that if the government did the right thing, we will get vaccine immediately and start to vaccinate the country and save the economy. That was one of the conversations. And of course, there was the misconception that if I am vaccinated, I will not get COVID and I will not spread COVID to anybody. I am hoping that before the end of the day, I will ask CMO again for the benefit of those who will not hear. Yesterday in Tobago, you would not believe this, after all that was said in this country, good, bad, and indifferent, yesterday in Tobago, a mall owner communicated with me in amazement that two families turned up at the mall where there are stores and had to be told that the mall is closed. And they asked why. And had to be informed by the proprietor that the mall is closed because the country has closed malls by public information. But wherever these people were, they had no idea that the mall was closed, and they came to conduct business as normal in Tobago. Small population. I mean, if it was up in, Cachipo or Platanal, I mean, I would have excused that. They might have had a bad signal. But it tells you that there are people in the country who are completely disconnected from the day-to-day routine of the average person. And these people were innocent. They weren't disregarding the rules. They innocently turned up to shop in the mall. Two groups in Tobago. So we have to understand that we have to keep, for those of you who are bored by the repetition, we have to keep repeating it, because we don't know who would be left out of the information and may not have taken that action to preserve their lives. Now, with respect to the availability of vaccines, for those who believe that, yes, vaccinate us and let's get going and ignore, the only thing we could vaccinate you with is an approved vaccine And that approval for Trinidad and Tobago had to come from the WHO. From day one, I told you, as Prime Minister, I will not authorize any vaccine to be used or to enter Trinidad and Tobago unless that medical product was certified for use by human beings by the World Health Organization through its sub-agency, PAHO, because of all the difficulties that will go with that. So all the people who were telling us to vaccinate because they know a man who have some vaccines to give to sell, if you go down that road, you complicate the issue in a way that would be so grave that we don't have to do it to know that. Because if we buy vaccine from people who cannot verify the source and the chain of custody of that vaccine, then we are putting the population at risk. And we are not prepared to add to the COVID risk a vaccine risk, which is beyond the level that we are accepting in the very nature of vaccination as a process. So we had our fingers everywhere that vaccines could have or ought to have been had. The first place our hand was in the marketplace to buy vaccines when they became available. I told you, and I will tell you again, even as I speak to you now, we, and not just Trinidad and Tobago, we in the CARICOM and other country areas, we have not been able to buy any vaccine because vaccines have not been in commerce to be bought in the normal trade. Vaccines in the initial part of this pandemic response became in the custody of sovereigns. We tried to avoid that before it happened by creating the COVAX mechanism. And you were told since last year, October, that your government has paid into the COVAX our requirement so that when the COVAX operated, we will be able to benefit. We did that as it was supposed to have been done. But that COVAX mechanism fell prey to the handling of the vaccines internationally because what was supposed to come to the COVAX never came. We were supposed to get 100,000 vaccines in the first pass. We got 33,000 the other day, and we are gladly going to receive 30,000 on Monday, and then we'll only be 2/3 along the way of the first expected tranche. The companies that got approval to meet our interests were Pfizer. Our people, as soon as Pfizer got the approval, we and the rest of the world were knocking on their door with our check in hand. Up to today, Pfizer is saying, we cannot sell you any vaccine. The reason being, their supplies were contracted by others who had the authority and the power to sell. Moderna was utilized in another country where it was developed, but under approvals for use in that country, meaning that those of us who were not in that country could not access it. And the same thing happened in the UK for another vaccine, which was approved, coming out of Oxford, but being produced in India. And a great misunderstanding went with that. That Oxford AstraZeneca vaccine, the factory to produce it, once it got approved, was in India. And of course, you know, all kinds of conversations went with that. And of course, we got a handful from there. But eventually, India is not now a supplier of that vaccine even unto itself. Such is the world. We got an offer of vaccines from China because along with the Western vaccines in Europe and North America, the Chinese were also out there making vaccines. But we said, thank you very much. We are glad for the offer. But until there's a WHO certification, we will wait for that shipment. We are delighted that the WHO certification has now come for use, and we will then receive and use one of the many vaccines that have been developed in China and have been shown to meet WHO standard and will be used in Trinidad and Tobago. Some of our CARICOM colleagues did not do exactly what we did here in Trinidad and Tobago. Some of our CARICOM colleagues, very early, facing the absence of vaccines that could be bought in the marketplace, had taken the decision that they would use the non-WHO approved vaccines. As Prime Minister of Trinidad and Tobago, I wish them well, and they went ahead. They used some of the Chinese vaccines, I think it was Sinovac, and the Russian vaccine Sputnik and so on. But those were decisions to be made by countries in relation to how they manage their own situations. Today, available to us is access or entry through the COVAX. That still continues, and we expect to keep receiving tranches as the COVAX is supplied. We have our application in with the African Medical Supplies Platform, which we are hoping, and they were hoping, that they will get large volumes of vaccines in April. We are now in May. That supply that the Africans were supposed to get, from which we were supposed to get a small amount, that has not come to pass. But we are still in line in the event that the Johnson & Johnson vaccine, which is the main one, is authorized for widespread use. And of course, now, I don't think we have any expectation from Sputnik because we didn't really try very hard there. But the Sinopharm certification, the Pfizer expansion now, production, and of course the Moderna certification brings some improved change to the environment. Not to mention that you would have heard the American government saying that they would put into the COVAX mechanism a significant amount of vaccines from contracts which they were holding onto themselves. Unfortunately, there was a problem with the delivery of that, and the latest we have had is that they're still evaluating the safety concerns of the attempt to produce that vaccine in the United States, which came up in some difficulty. So, yes, we're happy to be continuing the vaccination program. We will accelerate it based on the receipt of larger volumes. We will pay attention to how satisfied we are that there are more coming in to determine how much we use and when. So that is a management issue within the Ministry of Health. And of course, we still diplomatically are out there making our case to those who have influence with the supplies that are available. But when it's all said and done, treat the vaccine as it should be treated, which is a development which allows you at the personal level to respond better in the event that you become infected. That's what the vaccine is about. That you don't fall prey upon infection. Your body is now able to respond more successfully to an infection, but you can still become infected if you are exposed to the virus. And of course, you can still transmit it to somebody else. So when you put those three things together, one, the vaccine is for you if it enters your body to make your body respond better. But you can spread an infection to somebody while you're vaccinated, and you can still become infected if you are vaccinated. So don't use the vaccine coming as a pass to misbehave. And don't use the I have been vaccinated, so I am exempted. No. I can tell you there's one country in the Pacific that has a very high level of vaccination. Relatively small country. I think their level was 60-odd%. 62% vaccination. And I guess they thought, oh, what happened? It does not mean the end of the restriction in congregation. If we continue doing what worked for us before, scientifically, we can assume, make the inference, that if we did those things and they worked for us before, and we do them again, they should work for us again. Of course, the corollary is, if we don't do them, then we will end up in a very bad situation, and Dr. Heinz's graph shows us the exact road that we'll pass to get there. So, I am appealing to the population again. It's not a life sentence. It's for 2 weeks. Let us change our lives for 2 weeks. I think what we really should be doing is thanking those persons who have to go out, those essential workers. The whole talk shouldn't be selfish about ourselves and our comfort and our need to be treated specially. The conversation should be, thank God that we have a cohort of the population who is going to the breaches to keep the power on, to keep the gas flowing off the rigs, to keep the transportation going, to keep the hospitals going, to keep the water running. We have all those people going out there and doing that. The conversation should be to acknowledge them, defend them, support them, and try and be cooperative so that this period of hardship for them would soon end, but not be extended by our misbehavior. Because if we don't get the turnaround we're looking for, I know of no other solution. And once the hardships that go are the solutions available, it means that we are allowing ourselves to stay in this situation longer than is necessary. The greater the cooperation, the shorter the period. And that's what I'm asking for. Cooperation. And you at the individual level, peer pressure is a great catalyst in Trinidad and Tobago. Don't encourage anybody to misbehave. Encourage them to cooperate. You'd be amazed that they might listen to you if you are serious. And just try for one moment to choose the person in your family who you think you can do without right now. If you are required to surrender one or two to COVID. Which two? I know you might have some you want to get rid of, but everybody is loved. Everybody is loved. It's only when that death occurs that you know and you see the expression of love. You see school children playing, talking to one another. You never hear them talking about saying, I love you. But one get killed in heartbreaking circumstances. And then you see the outpouring of sorrow. You never knew those children loved their colleague like that. Let us be our brother's keeper. And as fast as you cooperate, as deep as you cooperate, you could ask me, I don't know where I got COVID from. Honestly. I was doing virtually everything that was required of me. And I thought I was safe. Next thing, I followed the protocol. I started feeling sneezy one night. I got tested the next morning. And I expected to be told, I thought it was a routine test, a confirmation test that I was negative. And the doctor says to me, you're COVID positive. A reality hits you. It hits you. There are a lot of people in this country today who are scared of us reaching the place that we're trying to avoid. I think we all should be. Because knowing that you are infected with a virus which has killed 3.5 million people, and that it could cause you to move from healthy to sick, to very sick, to critical, Dr. Trotman, what, in 48 hours or less? I could tell you, when I was in Tobago, certain people were very concerned that I should not be there. Because if I had gone that road, they might not be able to reach out to me in time. It's like that. What if they were reaching out to you? You see it in India? Very many people reaching out for a breath of oxygen are not available. And something else you see too. Dr. Richards is making the point, and I want to re-emphasize the point. It is not the number of beds in the hospital. The physical bed is only a place to lie on. For that bed to be functional in giving you the required health care, it has to be associated with doctors, nurses, and technicians. And each bed, and you see it on television sometimes, up to 7 people required on one patient to try to save that patient's life. 2 or 3 doctors, 2 or 3 nurses, technicians in the back room running up and down to save one person. So don't count it like that. We have 300 beds. It takes a number of years to generate one doctor. It takes a number of years to generate one nurse. It takes a few minutes to generate one patient. So ladies and gentlemen, fellow citizens, for the next 2 weeks, if you don't have to come out as an essential worker, an emergency intervention, either in the public or the private sector, for the next 2 weeks, stay indoors. I want to end on reminding you of the verses I read from Isaiah at the beginning of this pandemic, at the prayer morning we had here. And all it said was, close your doors and let it pass. We are back there. Come in, let it pass. We know a bit more now than we knew then. And therefore we should be more confident that if we do what we are asked to do, that the result would be useful. I am and I have been open to consultation all along on this matter. And that is why the supermarkets have suggested to us in their consultation with the small team of ministers who consult with them that we should consider the discount stores staying open so as to take some of the pressure off some of the supermarkets and therefore utilize all the floor space that we have. We're open to that. We'll see how it goes. Because if it becomes a place for linemen to congregate because this is the only place that is open, we will deal with that. And if, as we go along, we have to intervene again, we will. But we are certainly not going to be lobbied into creating a zone of comfort to persons who believe that this is not about me, it's about all you. And therefore, please exempt me from this and exempt me from that. We are trying to hold the line, and we are asking you to minimize your family's presence in the supermarket. Supermarkets are the place where we expect a lot of people to go because you have to get food. But if you go, don't take the whole family, please. One person shopping for your interests in your household. Remember, there's limited space down there. Inside, and don't build up a line or a crowd outside. And supermarket closes at 8 o'clock. Don't turn up there at 7:30, because it have a lot of other people doing that too. Right? Try and use the whole day. Use the full space and do it in the most effective way so as not to be a contributor to excessive time in the space and very little browsing. Know what you want. Minimize your exposure out there. Minimize your exposure everywhere. And I'm sure that if we do that, hopefully by the 23rd, we will do what we did before. We'll begin to roll back these restrictions and come back to a period of semi-normalcy. And of course, with our vaccination program going there, as a matter of fact, we should be a bit happy about the fact that there are lines, because there are people who want to get vaccinated. There are some countries that have vaccines and nobody wants to be vaccinated. Here, our people want to be vaccinated, and what we have been doing, what we are doing, and successfully now, is to have vaccines for those who want to be vaccinated and those to be encouraged. We can now aggressively promote the vaccination program a bit more because we expect to have some more vaccines available. When we didn't have the vaccines, we spoke about it. So let me end by asking the Chief Medical Officer here to let us understand finally what this vaccine is about. What is a vaccine, what a vaccine does, and how we should relate to it.
Prime Minister. So as you know, I went through a bit of what it is. Really, it is inactivated, in this case, inactivated viral particle that is injected into your body in some form or fashion, and it is meant to promote an immune response, building your immune system to a point where, of course, it can better fight the virus that is coming from the outside. So just to give a little more details on Sinopharm itself, Sinopharm is an inactivated vaccine. Other types of vaccines, for example, that are inactivated are like the flu vaccine, polio vaccine, for example, hepatitis A. It's an older platform than the mRNA type platform. It has been used for many, many years. It's a 2-dose vaccine, can be stored at 2 to 8 degrees Celsius. It is given at an interval of 21 to 28 days post, that's the second dose. And it actually, this particular vaccine is given an efficacy out of WHO of 78.1% in preventing severe disease, disaggregated across all ages 18 years and above. It has been used and is authorized for use in 45 countries around the world and has been given, I think, 65 million doses of this vaccine so far, which is one of the most widely used vaccines around the world, has a very good safety profile, has a very good efficacy profile. I think Minister would have touched on another Sinopharm vaccine out of another producer. And of course, there's the Sinovac vaccine, which has been used in Brazil, has a lower efficacy of about 50%. So there's some confusion, and just to clear it up, the Sinopharm vaccine that we are getting in Trinidad has an efficacy of 78.1 across all age groups 18 and above. So that's some brief information about this vaccine in particular. The shorter period of time between dose 1 and dose 2 is good, meaning that you can have fully vaccinated people much quicker in our population rather than having to wait 8 to 12 weeks with the AstraZeneca vaccine. And the 2 to 8 storage, of course, is again very good because that is what we are accustomed to and dealing with in all our supply chain for vaccines in Trinidad and Tobago. So I'll answer more questions about it as we go forward.
Thank you very much, Dr. Parasam. I think at this stage we'll open. Minister Young had a few questions that came in while we were here. So answer those questions and then we open the questions from the live audience.
Thank you very much, Prime Minister. Just to answer a few of the questions that have come in whilst we announce, and as I say, the publication of the new regulations should take place in the next few hours. Exercise. We're being asked about persons being allowed to continue with exercise as it currently exists. The answer is yes. Outdoor exercising, not in groups. So continue to maintain no more than 5, but of course we ask if you could keep it less than the 5, wear your masks. So outdoor exercising, wear your masks. No group gathering on that. ODPM, TEMA, the DMUs at the various municipal corporations, yes, they are included. The EBC is included. Vets are included. With respect to educational and the schools, we will continue to hold the line for now because we're right on the cusp of examinations with the 4, 5, and 6, and the teachers preparing for that, as well as the teachers preparing for SE, as you heard the Prime Minister say. We continue to hope that the SE exam will go on as supposed to, I think on the 10th of June. So that is the answers to those various questions that came in, and we just ask a person just hold strain for the publication of the regulations in the next few hours.
Members of the media, if you have any questions to any of the participants here, now is your opportunity.
Mr. Renuka Singh at the Trinidad Guardian. Over the past year and months, you've stood on that podium and you've begged, you've imposed restrictions, you've appealed to people's common sense, but nothing seems to be working. We are in dire straits now. What do you expect the Commissioner of Police to do to encourage people to be a little more compliant?
Well, the police has broad responsibilities to point out, to coerce, to restrain, to charge, to close, and I expect that they would use all of those authorities towards the effect of having people not congregate, having people not encourage congregation, having people not providing facilities for congregation, and in short, breaking the law. We are asking here for enforcement and to encourage lawful behavior. That's what the police will do.
But, I mean, what Minister Del Singh had said about, the lining of Independence Square, and I see it every single night. It's like it makes a mockery of everything you're trying to do, really. I mean, I don't know how to and could there not be, like, you make the appeals, but we've been here, you've done a gradual or gradated response to the country, and people are still out there doing it. So is it not time to endorse my colleague here? Is it not time for a little more firmer? I mean, there are specific locations at Independence Square where it's just crazy what's happened.
Well, I trust that the police is hearing you, and if in fact there are people breaking the law, well, then we expect to have instances of consequences. You see, the general attitude is that, you know, you got to demand that, but the man doing you that. Some people are telling you to your face and by their actions, I am not prepared to respond to anything but the heavy hand. That's what they're saying, you know. All that you say, in fact, one person was reported in the papers today saying all they're getting is information and they ain't seeing the dead bodies. Now, with an attitude like that, you understand what you're dealing with? And if, in fact, we have the regulations, there are penalties, there are inconveniences to come your way, there are people who are saying, I only going to do it. I mean, I saw a picture in a paper today, and one of you took a picture of people sitting down casually outside in the public, and their mask under their chin like that. Right? I was in Tobago the other day, and I'm driving past a group of people, counted 7 of them, every one of them had a mask. All mask under chin, conversation going on, and they were 1 foot apart. So that's what's been going on. And I know there's a recommendation, or there has always been a recommendation, have a state of emergency. All a state of emergency does, in addition to this situation, is remove your rights. It doesn't make you any more responsible. It sweeps the right away and allows for certain other things to happen. But those things can happen without state of emergency, because that in itself carries a certain kind of logistical difficulty. Right? So, for those people who believe that the only thing they will respond to is the heavy hand, well then, so far as the police has a heavy hand, you know, but we only have so much charge room space, you know. We only have so much jail space. And if we put them in a fence, in an open space in the sun, you'll be the first person to complain that all the man do is wear a mask. That is all the man do. Eh? Because that's how you'll put it. Not that the man could not care less about who infects him or who he infects, with the consequences of that. But I again say that I have confidence that ultimately the good sense and the common sense of the majority of people in Trinidad and Tobago will see these options as the best options available to us under the circumstances. And the more we cooperate, the shorter will be the period of purgatory.
From TV6 News, just wondering for yourself or the Minister could answer. Is there a point where the government may seek help externally in terms of the health sector if it does become even more strained than it is now?
External help comes in a variety of forms. As of now, we are relying on the resources we have indoors, because to look outdoors would be looking in a difficult place. External help in what form? You mean in personnel, in money? Well, the time to build a fire station is not when the fire is blazing, eh? We have built significant fire stations before, and that's why we have been able to hold ourselves in this position for a while. But if it becomes available, we will not say no, but we are not relying on that, because everybody is in the same position. Who are you going to look to for personnel in this situation, in a pandemic? Pandemic means every country in the world is involved in it and exposed to it. That's why it's called pandemic. And of course, we have had help from outside in terms of personnel before. We have a significant body of people in this country in the health sector, And all we have to do is to make full use of it. And more importantly, fortunately, we had done a number of things before. If this pandemic had come to us, say 5 years ago, we'd have been in a far worse position. Fortunately, when we had to act, we were able to put a parallel health system in place because we did have some infrastructure that allowed that to happen. So that was just sheer, I would say, luck. But luck flowing from actions we had taken before. The personnel we have in our health system didn't just happen to be there because a pandemic was going to come. This is the first time, I think, all of them, but they were trained for that. And we are to make that work for us. Money-wise, yes, we are accessing some help outside where that help is available. The Minister of Finance will probably talk that when he comes. But again, these are limited resources coming as assistance or facilitate you in some way. And where that's available, yes, we take that.
Prime Minister, let me just expand and probably answer Joel's question a little more directly. The decision we have taken, and is a decision that we didn't take lightly. The health sector is going to go back to how we were in April 2020 because we need people. The limiting factor now is people. As a result, elective surgeries are going to be reduced. We are only going to be doing what is called emergency electives. So the same grandmother that a young person infected, when that grandmother wants an elective surgery now, you, the grandson, has caused that. That will free up personnel. We are also going to be looking at our outpatient clinics. So you, the young person that infected your grandmother, who depends on these clinics, you are now responsible for that. And we are going to be moving back again to a heavy dose of telemedicine. This will free up doctors and nurses. So we have taken that decision. It's a decision we don't take lightly. But this is a result of our behavior. That the persons who depend on elective surgeries and the clinics now, can't get that optimal level of care. So I don't know if the CMO wants to add to it now.
So we have taken the decisions to do a few things. We noted with concern that the clinics are really large in terms of people who are elective in a way attending those clinics. It's causing a lot of congregation in even the hallways of the major hospitals. We have noted infections occurring in those hospitals outside of the parallel system. We want to, of course, get additional staff to be able to man the parallel service. So if we go down with the electives, it frees up some staff to go into the parallel system. What we have also done in terms of human resource capacity, the Defence Force, we have been in contact with the Defence Force, and they are willing to provide some support by way of medics, as well as other persons in terms of security and drivers and those kinds of things. So expanding outside into the Defence Force at this point in time as well.
Well, we heard the 542 beds in parallel health system. Was there a different figure announced when that system was first made public? And if there was, what would account for the change in the numbers?
Could you remind me what the figure you thought it was so that we could probably account for it?
It was more than 542. That's what I'm saying.
I think what you were counting was quarantine beds together with that. So that is where that difference is, right? Good.
Prime Minister Samalala, TTT News. I do have some questions coming in as well. With the Olympics coming up, not sure if Minister Young can answer. Would athletes be allowed to continue their training and so on? And secondly, licensing office, government offices, pending transactions, will that continue as well?
All right. With respect to the first question, at this stage, the answer is yes. But we haven't stopped the national training going on. With respect to licensing offices, etc., government departments are included in the exemption, but we're going to have to take a look at that. What we recently did, actually, was at Cabinet yesterday, is we extended the date, and I don't know if it's been announced by Ministry of Works and Transport as yet, but we extended the date for persons whose licenses and transfer vehicles have expired, and we've put it now to September. So that has given us some room. So we will have to speak to the Ministry of Works and Transport, because when I actually drive past Ryson Road and see large crowds, that get me a little nervous, because there's just large crowds still outside licensing office. It may very well be that we just suspend those services over the next 2 weeks, and we can now tell persons we've already taken the decision. It was done at Cabinet yesterday to extend the time. So don't worry if your permit has expired in the next 2 weeks. After that, if things settle back down and we get the results we want, we can return to where we need to be.
The TTT regulations, I know that was supposed to come in effect June 5th. Because of these lockdown measures, would that be shifted as well? That will...
Minister of Works and Transport will have to take a look at that, and then if necessary and it requires an extension, or if we can go ahead with it. So that will be looked at. We're still a little way off of that.
I think there's another question we're getting to in terms of, let's say, students who are adults who are on gate but have lost their jobs or income and so on. How do they, assistance in this regard, or how will they be treated?
The Prime Minister said the Minister of Finance has been in constant consultation with the Prime Minister, Social Development as well, and we are looking at that suite of what assistance can be offered. So let's just wait for Monday for the Minister of Finance to come and discuss that in detail.
Sorry, apologize. In terms of working at home, what would be your message to employers, both in the state, private sector, in terms of leave? Because there have been questions even last year that some employees were saying, well, look, their vacation leave was being taken up by this and so on. What is the government saying?
I couldn't speak to that now because I don't know the details of those circumstances. What I would say, though, is that employers are part of this problem, to be part of the solution, because they are citizens of Trinidad and Tobago. And I'm sure that they'll work out the best arrangements. And I'm sure some of the grievances, when you examine them closely enough, they are linked to the logistics of what is required. Some businesses will tell you that they run out of money. The government is helping in some way or not helping. But understand that this is not a perfect situation. And it's a changing situation, as a matter of fact. We are trying to head off much of the difficulty, but we are not for 1 minute saying that the playing field is smooth and perfect. So we're asking for cooperation. That is the word that we want to use, cooperation. Banks cooperate with clients and vice versa. Landlords cooperate with tenants. The government workers, you are going to be told, or you know who you are from previous experience, what your role is in all of this. So this chain of Trinidad and Tobago will be as strong as its weakest link. Don't be that weak link, wherever you are. Thank you all very much, and we look forward to seeing you again soon.
And that was a live press conference by Prime Minister Dr. Keith Rowley. You can keep up to date with all of the information coming out of today's briefing throughout our various newscasts. I'm Mahalia Joseph Wharton. Good afternoon.
This is TTT. Live for local.
Welcome to this afternoon's Playway Pick 2 and Pick 4 draw, supervised by independent auditors KPMG and presided over by the National Lotteries Control Board. Good luck, everyone.
Good afternoon. It's Friday, 7th May 2021. Welcome to the 4 p.m. drawing of the Playway Pick 2 and Pick 4 numbers. And first we draw this afternoon's Playway number. Winning number, it's 21. Luck you mark its mouth. That's number 21. And it's time to create your Megamix, where you can get your best value for $1. Our Megamix machine is loaded with 9 white balls, a Mega Ball, a Mega Ultra Ball, and the Mega Extreme Ball. If a white ball calls, you win the base amount of $26 for every $1 played on the winning mark. However, for an additional $1 each on the Megamix options, you can win an additional $85 when the Mega Ball calls. an additional $110 when the Mega Ultra Ball calls, and an additional $130 when the Mega Extreme Ball calls. Players, the Playway Mega Mix is your best bet for value. Mega Ultra Ball calls. And players, Playway mark number 21, Mouth, is called along with the Mega Ultra Ball. Congratulations to our Mega Mix winners. You've won the base payout and the additional Mega Mix winnings. Remember, you can play 1, 2, or all Mega Mix options for only $1. And now we draw this afternoon's Pick 2 numbers. First pick two number, it's 13. Number again, 13 now for the second pick two number. And the second